New York is just an incredibly stimulating town. It's crowded, it's inconvenient, we have our problems, but there's a certain energy about New York that New Yorkers feel. The creativity, the height of finance, the height of fashion, and it's a very international city. There's just something about New York. So for most of my adult life, I actually considered myself a triathlete, meaning I knew where I was in any given season. I was training over multi-seasons. Not to say that I was necessarily a very fast triathlete. Been on the podium once or twice, more a middle of the pack person. But the point is that it was such a part of my identity. And I knew that I was living my best life when I was in a good training mode. And then all of a sudden, it all changed. Being healthy, feeling fit, having a certain level of energy, even more important today for me, but especially because it all fell apart. It was the darkest tunnel I have ever been in. It feels like it's overnight, and all the ladies I know, particularly the athletic ladies, we all say it felt like it was overnight. I appreciate it even more because for a while there, I lost it. My name is Susan, and I have survived menopause. It's weird because I really only understand the symptoms looking back. I had no frame of reference. I didn't even really stop to acknowledge them, but I remember the first time that I went through night sweats. I woke up in an absolute puddle, but the puddle was like from my neck to my feet. I must have knocked my water bottle over. But I didn't. It was there on the nightstand. I was completely drenched. I had to change the sheets, but I didn't really stop to figure out what was going on, and I had no cultural or collective experience for me to tap into. At that time, I was in a great triathlon training group, so I was still running and doing the strength work and all of this, but the symptoms were there.
I give a simple definition. It's the pooping out of the ovaries, pure and simple. I don't like to use fancy terms about stuff. I want patients to know what I'm talking about. The ovaries will start working in all of us who have ovaries at some point. Average age these days in the United States, average age is about 51 when the ovaries really poop out. Now, they still make a tiny bit of estrogen after menopause, but not a heck of a lot.
My last period was in the summer of 2019, which means that menopause, which is a moment in time, 12 months later, summer of 2020. I couldn't regulate my body temperature to save my life. I'm complaining to my landlord all the time about the air temperature. I had a girlfriend of mine at a work dinner. She said, "I'm having so much fun counting the number of times you take your sweater on and off."
I think the classic symptom of menopause that women identify with is hot flashes. Hot flashes, night sweats, brain fog, irritability, fatigue, increase in type 2 diabetes, depression, anxiety, dry skin, painful sex, urinary tract infections, urinary frequency and urgency. I know it sounds depressing, right?
It's always been taboo, still is a little bit, but it is tragic that modern women have lived in silence for so long. Like my mother never said anything to me about it. And truthfully, when I started going through the worst symptoms, I would say to my older girlfriends, "What the bleep? Why didn't you tell me about this?" One of the difficulties is everybody's experience is quite different.
Let's talk about some of the other symptoms that women can experience in menopause. In the United States, a lot of women complain about brain fog, fogginess. They complain about mood disorders, sometimes depression. And we do know, for example, if somebody has a history of depression before menopause, she's probably 3 times more likely to have a depressive episode during menopause than she was before the menopausal transition.
I was working out and gaining weight, and so I did what I know to do. I worked out harder. It felt like the more I worked out, the more weight I gained. And over the course of those 18 months, I gained 20 pounds all the time while doing the best I could to keep up my training program. You know the inputs, you know the training, you know the nutrition, you know the sleep, and you know how your body will respond, and it will respond. And then you go to the menopause and all bets are off. All the rules change and everything that worked before is backfiring on you now. And you think it's a failure of will.
One of the biggest complaints that I hear every day of my life, weight gain, weight gain, weight gain. The other thing that women complain about almost universally is redistribution. And even if they don't gain an ounce, basically it all goes to the central area, right in the middle, okay? And that probably is related to the lack of hormones.
I did go through this period where I thought, it's all over. And I am not talking just about what I look like. I am talking about having a level of energy that makes you at least enjoying life, not to mention excited for life. I did think for a while that it was all going to go away because I couldn't see myself climbing out of this pit I was in, and I didn't recognize myself. And actually, that's when I recognize my younger sisters who are going through this. I feel like the most important thing that I can say to them is this is a transition, and you will get through it. It's really like when you recognize that despair in people that you know and you care about, you want to send a lifeline. And that's, the husbands need to know that too.
Many women feel significantly moodier in menopause. There's with loss of estrogen. However, the other thing that we, as menopause providers, that we find it very difficult to elucidate as far as what's causing what. This woman is menopausal, okay? She is a person who is menopausal. So she is dealing with her job, she's dealing with her partner, she's dealing with her kids, she's dealing with, and one of my standard jokes that I use, she's taking care of her ailing mother, and even worse, she's taking care of her ailing mother-in-law. And she's doing all these things at one time. And is she stressed? Sure.
But in addition to being tired is the sense of helplessness. I still wake up at about 2 or 3 o'clock every morning, and I'm wide awake. It's like I wake up and I'm already in an argument. So that's been the greatest impact on me. As I began to realize how difficult this is, my thought was, I can't believe that more women's careers don't derail, and I can't believe that even more marriages don't break up. Because when you are caught in a tunnel that seems that long, feelings of hatred are pretty prevalent, feelings of despair. So it's really complicated at a complicated time of life.
I am with a company called iHeartMedia. I oversee all of the nationally syndicated programs and services through Premier Networks. I work with celebrities and a host of other talent to make and distribute their radio programs across the country and the world. I was feeling a little bit off, and so my GP suggested the blood test. My sense of menopause and things like that is that it happened to older women, that was something in your 50s that might happen or would happen, but certainly had no sense that it was something that could be happening to someone at my age at that time, at 44. So I was not expecting it at all. And when I got the results and saw that my hormones, jokingly I say, they called and told me I had the hormones of a 70-year-old woman. My name is Jennifer, and I went through menopause and came out the other side. It was the first time that I realized that there was finality to one's biology in terms of having children anyway. And so that decision that I never really had to make was now made for me by my own body. I realized that instead of being a person of many potentials, or potentially infinite potentials, that some of my potential was limited, and specifically some of it had just gone away forever. The first thing I noticed, not realizing it was attributable to the menopause, was mood related, so some depression. And when I say depression, it was almost a kind of emotionally exhausted with no reason for it. And along with that, brain fog, confusion. So I had spent the better part of my life really relying on being quick thinking, and suddenly I was slower. My mind wasn't working the way I was used to it working.
She handles it. She has that kind of grace that I don't understand. She's able to just, she's herself. I mean, she's the same person in both ends with kind of episodic struggles. Sometimes she goes for help and sometimes she doesn't, right? So toward the end, or some years into this, when the symptoms, it's kind of undeniable that things are changing and she's not feeling well, she lucks out and ends up with this terrific doctor who says, yeah, actually, there are things we can do to help you. You don't just have to power through this stuff, which is her inclination.
So when I went to see Dr. Minkin for the first time, I think I asked what she could do, or what could be done about these unpleasant symptoms that I was dealing with.
Hormone replacement therapy is extremely effective, but one of the songs I sing for my patients, and I have a horrible voice, is that James Bond song, "Nobody Does It Better," and estrogens are gold standard.
It is essentially giving hormones, the two hormones, estrogen and progestin, that your body makes usually in a normal menstrual cycle. You make estrogen in the first half of the cycle, and then you predominantly make progesterone the second half of your cycle. That's how our menses are regulated and created. So what we're using in menopausal hormone therapy is actually those same type of hormones. They may vary in how we give them, or the actual chemical composition, but they're very similar to the hormones that we make. And we use them because we are trying to, again, alleviate some of the symptoms that are caused by hormonal fluctuations or even the lack of hormones. So those are the two main ones that we use.
And I'm pretty sure that I informed her that, of course, it's not an option for me to take hormones because my mother had breast cancer, and I know that causes breast cancer, and blah, blah, blah.
And we can get into a lot of details about it, but the increased risk was minuscule. It was tiny, and many people looking at the statistics said it wasn't even a real risk. It basically was way overblown, because what happens is that American women, because they are so terrified of breast cancer, because it's a terrible disease, when they hear the word breast cancer, their minds shut down. And if anything's going to increase their chances, even a hair of a percent, we're not interested in it. Not if the drug makes you feel better, not if the drug protects against other issues. They hear the word breast cancer, they're out of there.
And she kind of said, whoa, time out. We're going to need to sit down here and go through the reality of hormones and options, because you have seized on one little aspect of research that got released in a way that really has been doing damage, I think, to a lot of women for a long time since, which is not really the case. So she explained to me a number of variables in terms of what that research actually said, which had to do with the degree of increased risk for starters, the difference between the risk for people only taking estrogen versus combination of estrogen and progesterone, and really thoughtfully and with data was able to show me that I was absolutely a candidate to take hormone replacement therapy, and that it was not going to cause me to have breast cancer. That I was wrong.
There are some women who are anxious about taking estrogen and have become more anxious in the last 22 years approximately. But certainly it was used for a number of years. And actually estrogen was introduced into the United States in about 1942. The first estrogen product came on the market. So it's been around for a long time.
It's awful to think of. I am sad that I lost as much time as I did from the time that I found out what my hormone levels were till I finally met Dr. Minkin and realized I could take medication to help me. So I lost a lot of years, and the idea that some women do what I did indefinitely and never get help is a terrible thought.
She felt better. Over time, it worked, and she had permission from this world-renowned doctor to do this, right? It's safe. Go ahead. You'll feel better. And, she did. I remember her being relieved, that she had somebody who was looking out for her, taking care of her.
I've joked with friends that after I started taking the estrogen and felt so much better mentally, I wasn't depressed, I wasn't as forgetful. It turns out it was all just the estrogen, because my superpowers, right, my strengths, mental strength, started to come back. And I felt like myself again. So it was kind of amazing to realize that one little change in your chemistry could account for so many of the things that you think of as you to not work right. So I was thrilled, very happy to see that it was working.
That's the good news. And I think that as long as we continue to show what vibrant 60-year-old women look like, 70-year-old women look like, then I think that we'll approach this phase of life more with anticipation than with dread.
Give you my standard talk that if I'm talking with somebody, one of my regular patients who's beginning to do some menopausal issues, or new patients who come in to consult with me. There are several tiers of interventions, and I think I always think it's a joint decision. You listen to the patient and you make a decision together. It's not my decision. I'm here to guide her. And so with this shared decision making, we want to go through tiers of how much intervention do you want? And obviously what's going to play into that? The patient's belief structures.
I'm on an estrogen patch, and I will say that my energy has returned. My interest in living life and seeing what life has next for me is certainly here, and I am grateful. So there was a book called Roar, which is about female athletes and hormones generally, but there was a chapter in it on menopause. And the author is Dr. Stacy Sin. She's one of the leading researchers on hormones and performance. So you have to compensate for that with a lot of weightlifting and a lot of eating protein, and you learn so much. Probably more important than that was you learn that you are not alone, and that there are lots of other athletic women going through this, hitting the same brick wall that you hit, saying, I don't know my body anymore. My body was such a part of my identity before, it's not responsive. When you find another group of women going through that who are as concerned as you are, then you start to see the light at the end of the tunnel. And then the real answers start coming too.
As someone said, menopause is having a moment. So I think as people are less shy about discussing it, again, I think we need to change the social baggage around menopause, and all of us deserve and owe it to each other to not whisper about the change or allow it to be in that space of unspeakables. No one wants old lady things and that's terrible. Don't talk about it. Don't think about it. That's what keeps people ignorant or contributes to people staying ignorant.
In the United States, particularly for the aging issue, because we tend to worship youth. In many of the Eastern countries like Japan, countries like China, where a person who is older is considered a wiser person. Women in certain, cultures have less complaints about menopause because the older women are revered, not discarded.
It is not easy, and I will tell you this, it can be a full-time job, just learning what you need to know about menopause and what you can do. And then, not only is there learning all the levers that you can pull, which ones work for you? Because it's not uniform. So it has made me grateful. It's also made me humble. I mean, I really cringe when I think how smug I was looking at older women. Many years ago, there was this magazine called More, and it was for women going through these things. And I read that magazine and I was like, that is not going to happen to me. I am a health nut. I am a training triathlete. This is not going to be me. And I'm humbled. And obviously it makes me feel a lot more compassion and a lot more sisterhood towards older women who, to me, they just look like what they look like today.
It's not a terrible thing. Try not to buy into this stigma that it's an end. It's a change. But if you think about it, if you're lucky and healthy, you spend more of your life not being fertile, if you will, right? The phase where you're capable of making babies is kind of a small portion of your life. So most of your life is going to be lived on this side of the fence. And it would be terribly sad to think that people look at it as the beginning of the end or something negative. It's hopefully the best part of your life. I'm planning for for it to be the best part of mine. So don't believe the negative hype. You're fine. You're going to be fine. The change part's a little bumpy at times because you haven't changed in a long time, but you're just fine on the other side.